Hello, I'm Dr. Doug Thompson, and on behalf of the doctors of integrative oral medicine, I'm very excited to bring the news that we'll be seeing patients for non-emergency services, meaning otherwise elective dental procedures, starting June 1st. I'm very excited that this has finally come to be, and we're happy to see you and anxious to see you. There are a few changes in the office, and I want to make you aware of some of the things that you can expect. One, before your appointment, regular or otherwise, there will be some questions that you'll need to answer. Answering those questions will give us some assurance about your history with disease and people that may have had disease that you've been around. Also, we'll have the opportunity for some testing, and this is for active disease testing. So for anyone that feels insecure about their knowledge of their potential risk for the disease, we could do some testing for you. Some of our staff, most of our staff, depending upon their work schedule, has been tested. So we can assure you that we don't have the disease and we don't have the virus. Also, you'll notice some changes with the waiting room. It's virtually non-existent. In other words, we're encouraging people to wait in the car, text us when you arrive, and that number will be in your pre-confirmation or your pre-appointment confirmation, and we'll be happy to come and greet you, escort you into the office. You'll experience some longer appointment times. You'll also see some changes in the office, in the way we've organized some things, in the way we've managed the ambient air in the office. In other words, certain scrubbers and keeping the air clean and the air quality clean for you. Also, our surface disinfection strategies have changed a little bit, and some of the things that we wear for personal protection will change. Our masks will look a little bit different. Maybe you'll see more use of visors or headgear or something to keep our faces less exposed. And then for you on the way in, there will be a temperature check. There will be a check of your body's oxygen level. These are some common things that are happening across the board in many different scenarios or areas out in the world that you're experiencing now. Social distancing, wearing a mask while you're in the office is a must. You'll see our entire team is wearing a mask. But all in all, it's really not that bad. It's not that bad for us, and we want it to be very pleasurable and a nice reuniting experience for you. So again, we're anxious to see you. We're anxious to get back on track. I am asking for your patience in spacing of the appointments. Many appointments are going to have to change the time of the appointment, maybe by 15 minutes to a half an hour, as we start to work through the schedule. We also have a tremendous backlog of some people that are highly disease susceptible that have missed. So some appointments are going to be repositioned. We've also had some staff changes. That's just inevitable at this time, and it's something that we're looking forward to maybe greeting a new face or two, but in the long run, it's going to be still a highly dedicated, dynamic team, and we are, again, super excited to rekindle relationships that have been put on hold and to establish new ones. If you're a potential new patient to the office, I don't really like to meet new patients in a mask and face mask and behind this gear. So virtual examinations and a virtual meeting until we get this sorted out further is going to be commonplace. Also, if you have a test in the office, if you have a diagnostic test, some sort of salivary diagnostics, many of those consultations will be done virtually. And we'll do that to save you from coming to the office and save us from the work in transitioning our operatories between patients, which has gotten to be quite a bit more than it was before. So I welcome you. I'm excited for us, for all of us, and I'm happy to help you maintain your oral health, which is so critical to your overall health. So again, I'm super happy to be back. I can't wait to see you in the office. Thank you.